will not die. Instead, they will live forever with God. And honestly, for me, God has set the example of how we should live. We should live from the place of love. We must learn to do everything that we do from the place of love, because love conquers everything. And God has shown us this perfect example, by setting the precedence and doing it himself. So let's love, let's do all we do from a place of love, because love conquers all. Anyway, thank you, everyone. Thank you for joining me today. Beautiful people, anyone who's joined us today via YouTube, thank you. Thank you for joining, and thank you everyone who is joining via Zoom. My name is Toyin Taiwo. I am a women's health advocate, a change maker, and a fibroid warrior. And this special live event on Zoom today, we're having question and answers, Q&A on fibroids, and you can ask us anything. So please, when you join, if you have a question, burning question, we have some questions that have been asked, and we're gonna ask you ladies today. But also, as you join in, and if you have questions, please put them in the chat, and let's get going with this. But tonight's all about you, honestly, and your questions, your stories, and your health. So this fibroid Q&A is an opportunity to ask us anything that you think you need to know, any help that you might need, at this junction in your fibroid journey, or it might also be someone that honestly, and you're supporting someone who's going through this fibroid journey. So we're here to help get your answers, feel heard, and also that you're not alone. You are not alone. And so today with me, I've got these incredible ladies, who I admire their work and the impact that they are making and helping women. Thank you so much. I've got with me Dr. Kazal Omar. She's a consultant gynecologist. She brings years of medical experience and compassionate patient care. So thank you for joining me today, Dr. Omar. Also with me tonight and having this conversation is Nina Lemter. Nina is a womb care specialist, and she's a fibroid awareness campaigner, and she's lived the fibroid journey. So now she's helping women heal. So thank you, Nina. Thank you for joining tonight.
Thank you.
Thank you. Thank you, ladies.
Thank you so much.
Yes. So I'm not sure how we're doing yet for oh, okay, I can hear the beeps. People are joining. Thank you for joining. Welcome everyone who's just joined us. Thank you. So safe to say that this is a safe space. As you ask your questions on fibroids, either medical, emotional, or lifestyle, this is a safe space. You can ask any questions and we will do our best to answer your questions. So let's get started. And please drop your questions and any comment at any time in the chat. If we're ready, first I'd like you to do a mini intro, because I know, Nina, you have to leave soon. But Dr. Omar, if you want to introduce yourself quickly before we jump right into it, if that's okay.
Okay, all right. I'm Kazal Omar. I'm a consultant gynecologist, and I specialize in a lot of gynae problems, and especially the fibroid, endometriosis, and polycystic ovarian syndrome, and menopause. And I work in a circle healthcare and NAFEL. For the time being, I retired from the NHS. Unfortunately, wasn't my passion to retire, but I had to. And but I'm here. Anyone want any advice, any explanation? I'm ready for it. Thank you.
Awesome. Thank you so much. Thank you very much for the intro, and thank you for joining us tonight. And Nina, you want to go, please?
Good evening, everyone. So my name's Nina Lemtir, and I'm a nutrition lifestyle strategist. I am a mum of 3 children as well, and I had to heal myself over the course of 10 years plus, and I've never felt better. And I equip women with not just information, but tools to empower their wellness from a deeper level, so that they can support their body's natural healing capabilities. So I'm super passionate about women's wellness. And I'm really grateful to be here today with you guys. Thanks.
Amazing. Thank you. Thank you. Thank you for joining us. So we get right into it. And please, as many as you've joined us, either on Zoom or on YouTube, sorry, on YouTube, please tell us where you're joining us from. And in one word, tell us what your fibroid journey is, if possible. Just one word, if possible. Share your fibroid journey. Thank you, everyone. So let's have a little bit of background about what fibroids is, and then we jump into questions that women want to know, because just in case it's someone who doesn't know much about fibroids, or I doubt there is, but I never say never, maybe someone who doesn't know what fibroids are. So Dr. Kazal, can you please, tell us what fibroids are and why they're so common?
Yeah, fibroid is a growth from the fibrous tissue and the muscle of the uterus. And usually it is proliferate the fibrous tissue and the connective tissue from the wall of the uterus. And it is proliferation can be more, and unfortunately it cannot be controlled very easily, but it is usually it is supported by the hormone, more or less by the estrogen hormone, which make the proliferation is higher and causing this problem for a woman. And it has no like a guidance, but it is happening, and it is hormone control and can be also genetic control.
All right. So the reason why it's common is because it's hormonal. It's from hormonal or hormonal imbalance or hormonal fluctuations. Yes.
Yes. Yeah.
Thank you. Interesting. Okay. Thank you for that. Can you share from your perspective what symptoms women should never ignore if you're living with fibroids?
The most important thing, especially when the girl have started their period, heavy period, irregular period, painful period is very important to be ignored. Maybe not related with the fibroid, but if it is happening, it's better to be diagnosed, as it's better to be looked after.
Yeah.
Early diagnosis is very important. Even if there's a small fibroid, you can follow yourself and see what is the reason for that. Yes, I have seen a lot of girls in their teenage, they have nothing else. They have no fibroid, but still they have a heavy, irregular, and painful period. But any irregular, painful, heavy period should be investigated and should be either include or exclude the fibroid.
All right.
So
Thank you.
It's very important.
Thank you for that. And that's, like you said, that's really important, because whatever it is, it might be fibroid, it might be other things, but it's just what investigating. If you have heavy, irregular, painful period, it's important to have it checked out and just see that everything's okay. But most likely no, because if it's painful, if it's heavy and irregular, something's going on. So just, have the investigation done, and it's key to speak up and get looked after.
Yeah.
Thank you. Amazing. Thank you very much for that. And like you also said, some women don't have these symptoms, because I know quite a number of people who only found out about fibroids after maybe they were pregnant and they went for a scan and like, oh, you got fibroids. Like, what are those? So yeah, but
because they were ignoring the other symptom. The problem is because some people thought that symptom they have is normal. That is more or less the reason. Yes, there are cases maybe have no any symptom until they go for fertility, or just accidentally by ultrasound they found out a little fibroid. That's nothing. But some of the women, they ignoring, they think that's normal to have a heavy and painful period because
That's right. That's right. And that's so correct. I hear you, Dr. Omar, because honestly, it's been ignored. Sometimes women just ignore it because they think that's the norm, that it's normal to have heavy. And also one person's heavy is different from another person's heavy. So when you don't even know what your heavy is, you just ignore it and just live your life without having any checks or any investigation. Thank you for highlighting that. Thank you very much. So I'm going to come to you, Nina. Um, share briefly your story, how you got diagnosed, and what early symptoms you had.
Yes, sure. So I was pretty much doing what Dr. Omar's mentioned. I took my symptoms to be normal.
Mm.
Heavy bleeding, painful periods, cramps, um, very moody, constipation. And it was just my normal until I started to experience like flooding in
Mhm.
regards to the rush,
Interesting,
rush.
interesting choice of word. I like that, flooding.
Yes, that's what it felt like. And that was where it was very alarming because
Mhm.
now it was really infringing on my social life. And, one time it happened
Quality of
when I was
life.
in the restaurant.
Oh,
So
wow.
it wasn't normal to me because I saw the shift from very heavy to, extremely heavy. So
Mm.
that was where I started to kind of investigate and you know, go for scans and things. And then not long after, I got diagnosed.
Mm. Oh, wow. Oh, wow. Interesting. And it's I like the fact that the perspective of Dr. Omar and your personal perspective is similar. I mean, even though the spectrum of experiences, um, can you be kind to mute when you join, please? Or can someone please mute everyone except when talking? Can you be kind to mute when you join, please? So as I was saying, that even though there's spectrum of experiences, but it's interesting to see that from Dr. Omar's perspective, as a clinician, and then yours with personal experience, is similar in what to look out for. And if you've been diagnosed, or, put a comment in the chat and let us know how long it took before your symptoms was diagnosed and how long you had to wait. So one more thing that I want us to do quickly, Dr. Omar, before I start to hit both of you with the questions that we have, can you briefly, Dr. Omar, highlight the differences between a myomectomy, hysterectomy, and maybe 2 or 3 non-surgical treatment that there might be, so we can just understand it, and then we start to ask some of the questions.
Yeah. It is the difference is depend on the type of the fibroid, depend on the patient's age, depend on what they want from the treatment. That is the 3 things which we are looking for. If the woman is young and the fibroids are very small, they even not need any treatment. They are very small that we just follow them and hoping that they get pregnant. And if it is increasing in size in the future, then in the future we will follow and plan treatment. Myomectomy it means taking the fibroid. Taking the fibroid, there are 3 type of myomectomy. One of them is depend on the type. It is, as I said before, if it is inside the womb, which is called submucous fibroid, and it's only one and causing heavy bleeding, and the others, they are very small. It's called hysteroscopic resection of the fibroid. It means through the minimal access surgery, we put a camera through the neck of the womb inside the cavity, and we shave out the fibroid.
Right.
That is one of them. The other one is laparoscopic. Most of the laparoscopic surgery, the fibroid should not be more than 5 centimeters and should not be more than 3, because the fibroid base is very, very vascular and can cause a lot of bleeding. So you have to be careful how much time you take and how much bleeding are you responsible for and how much the patient tolerates. The abdominal myomectomy, it is more or less for many fibroids with enlarged and in different parts, whether they are submucous and is associated with in the wall of the fibroid or in the top of the fibroid, and what symptom the patient, because maybe a very big fibroid just sitting on the top of the womb but causing a pressure symptom on the bowel, on the bladder. These are causing also a lot of problem for the women, so need to be coming out. The hysterectomy, as I said, is depend on the age of the patient, and if the patient have really finished her family and over 45, to be honest, that doing the myomectomy for such a woman is not practical. If they finish the family, as I said, if they don't need the uterus anymore, it's better to take the fibroid with the uterus. You can leave the cervix, you can leave the ovary for them and for the future. Although the age of ovary come down after the hysterectomy by 2 years, but you don't know when the woman is going to be menopausal, because some people have 53, some people start their menopause from 49, 48. And also the symptom. If the women have a lot of problem, pressure, bleeding, heaviness, affecting their even eating, what they eat, movement, exercise, these are also maybe contributed to the hysterectomy if they finish their family or they don't want to have any children. And even recently, we have done a myomectomy for the women who they want to egg freezing because they have no partner or they couldn't find the person to have children with, and they can't get to the ovary because of the amount of fibroid they have. So they have to have a fibroid removed. The other option, which is a medical or minimal access, also, it is called uterine artery embolization. It's very successful, and recently I have a follow-up of around 1 to 2 years of the women with they have uterine artery embolization. They are very good now. In the beginning, they were afraid that make the woman menopause, but now it is really very successful and can be done even if the women have no children, because the fibroid with uterine artery embolization, it become powerless, not affected by hormone, not affected by the blood vessels, so it's not going to grow again. So if the woman reluctant to take the uterus out, reluctant to have any surgery for the fibroid, uterine artery embolization. And there is also tablets. The tablets also, that's why I'm coming from backward to forward.
I hear you.
because the tablet, it can be used for a year. Liver function should be good before starting. Can cause menopausal symptom. Women have to tolerate it very well. Stop the bleeding. But after a year, still I have not any data that's saying you can do it for 2 years or 3 years. But after a year, I have two patients which they fibroid grow again. But in between, if they manage to become pregnant or they want the pregnancy, then they can have the pregnancy. And then, so it's every woman, you have to know the age, the children, wanting children, have children.
That's right.
And their symptom. So each woman has to be weighed accordingly, has not to be like the diagnosing and treating generally. There's no general, especially with the fibroid patient.
Absolutely not. And I wanted to highlight two things that you said that jumped to me. I just didn't want to stop you because with hysterectomy, honestly, is a controversial thing that I'm not even going to get into it today because it's going to take our time. Honestly, I do know. I mean, and it's something that happened to me. I do know a lot of women who really want concept, even if they don't want children anymore, because I didn't even want children anymore, but I just wanted to keep my uterus, you know.
Yeah.
So,
if for example, if you from the beginning, when you were diagnosed, you've been directed to something which is less invasive, more conservative, you would be very much healthier. You would not be ending up with a hysterectomy at all.
Absolutely.
Yeah.
So, that's what I wanted to highlight. That we don't need to just slam hysterectomy at people, even if they don't want to have children.
No,
still their choice.
Why not? Why should go to major? Yeah,
we should be looking for options. You know, I wanted to get to embolization, but we're going to raise that later on because that thing is very painful. I don't know what the difference is between having an open surgery and UFE, but we'll have that conversation later. But I wanted to come to you, Nina. You know, share with us what your decision-making process was for your treatment and what kind of treatment have you had?
Yeah, sure. So my decision-making process was very limited because I had suffered miscarriages and I was basically told, due to the size of the fibroids, it was the hysterectomy was likely. That's what I was warned based on the blood loss, potential blood loss, that they may have to just take everything out, which scared me totally. And I had to kind of do research and then suggest to the consultants to not attempt to remove all the fibroids and just focus on the largest ones. So it was the myomectomy that was suggested based on the fact that I wanted to possibly have children. From my research and from what I was told, it wasn't, the UFE wasn't even mentioned. But then when I had heard about it, it's not ideal if you do want to have children, because the blood supply being affected may impact the ovaries. So it was the myomectomy, and yeah, it was successful, and they left some fibroids because of the blood loss. So it was a partial removal.
All right, thank you for sharing that. Dr. Omar, are you there? I wanted to ask for guidance around something that Nina just raised around UFE not recommended if you're wanting to still have children. Can you give us your perspective on that, please?
It's very important. You have to look on that when we do a myomectomy, for example. And yes, the uterine artery embolization, 5% chance affect the blood supply to the ovary, and the woman can end up with the menopause and not be able to have children.
So that's 5%. Sorry, this is 5%.
Yeah, 5%. Yeah, only 5%. But this 5% is with the experience. You have to know there are currently there are few radiologists, which consultant radiologists, they are very experienced. They try their best not to do that, but it's still 5% chance, and you have to sign for it. If you can't and you are worried about you may be the 5%, and sometimes we say you may be the 1%, which is happening to any other complication. So what we, if the woman wants definitely the surgeon not to take the uterus out and want what we call a partial myomectomy, taking the fibroid, which is you think that is affecting the fertility, and leaving the others, which is they have a risk in the later on in life, may increase in size also because of the hormone supply. But if you think if you're taking every single fibroid, and you may ending up with damaging the womb or damaging the ovary or damaging the blood supply, it's better to take as much as possible, but not affecting. But so far, I can say, I don't know, hopefully that will be until I retire from everything. I never ever taken the uterus out if I have taken the woman for taking the fibroid only and end up with hysterectomy. I manage it very well with the blood loss, because the blood loss is the most important thing, which some women may end up with hysterectomy because they can't control the blood loss. And second thing, if I know there is a fibroid which is on the way of the ovary or the way with the blood supply of the uterus, I may leave that, but I tried 99.9% to take the fibroid away. As I said, maybe there may be one fibroid there and here is not affecting the fertility, is not affecting anything else, and very small. Yeah, maybe left, but I take fibroid as much as I can. I have done on Monday 2 myomectomy. One of them was 21 and one of them was 16 fibroid. One of them was not for fertility, but the other one was for fertility because she wanted egg freezing. But the unit which they were doing egg freezing, they couldn't reach the ovary because of the fibroid she has. So it is different. When you open or you do a laparoscopy or you do the hysteroscopy, you have in that moment, there are something in your mind. You are going to decide what you do for this patient, not what you like to do, what this woman need to be done is important. Yeah.
Wow. Thank you for that, and that's really important. And also knowing that, I mean, I know we got from talking about UFE to myomectomy, it's just putting all the options that patients got before
Yeah.
them and
Yeah.
helping them, guiding them to make the best possible situation decision for their own particular situation. You know, it's really key.
The
I
guidance is very important. The option there, because there are women come to me, they had all option in front of them, but they don't know which one is good, better for them. So it's
yeah.
not only you give the option and you say, these are the option, tablet, UAFE, or taking the uterus out or taking the fibroid out. You have to tell that woman, if I am in your shoes,
Mhm.
I would have done this and that. And then your choice to decide and go and read about each one of them.
Yeah, absolutely. So that's where
Yeah. Mm.
guiding the patient comes
Yeah.
into it, you
Yeah.
know, with all the
Yeah.
options that you have put before them. Thank you
Yeah.
for that. Nina, I'm going to come to you. So how with your journey, how did you prepare your body pre and post surgery? Are there natural or lifestyle changes that supported your healing? You know, how did you navigate that?
Yes, so pre-surgery, in all honesty, there was no preparation. It was survival
I
in
hear you.
regards to just managing nerves. And I think I
Mm.
worked more on my mindset. I was praying and, God gave me a vision of angels standing outside the
Oh,
operating room.
that is beautiful.
Yeah, and that
Beautiful.
uplifted me.
So comforting.
And yes, yeah. But post-surgery, I worked on my diet. I changed I had to change careers because it was extremely stressful what I was doing, and I just navigated learning more about my body, about nutrition, and
Mm.
really just started investing in myself, which was something that I hadn't really explored. I was more, can I say, more materialistic. I would buy kind of bags and things like that, but the concept of investing in, supplements and courses to learn more about my body, that was an area that I was now exploring, and implementing.
Yeah, thank you, thank you. I mean, most of us post surgery is when we get to then start to do the learning. I mean, I speak for myself, like yourself. Before, I mean, before the surgery was just, well, I was fighting for my life. I wanted to just leave because I've been bleeding for 2 years, right? So
Wow.
honestly, so post surgery was when it started dawning on me, like when I realized I wasn't the only one, because for a long time I thought I was the only one. But I mean, you had angels comforting you. Oh, lucky that I wish I had that. Well, honestly, God was good, was faithful. It was quite a
Mm.
tough journey, but it was amazing, and obviously why this was birthed, which is the Feminine Health and Fiber Network. Honestly, the things that I didn't get, I thought women, we need to give it to women, and help women.
Wow.
And is that hence why this advocacy, honestly, advocacy around fibroid is now more urgent than ever, because too many women are suffering in silence, honestly, and some even misdiagnosed, some mistreated because people just hand all the different kind of treatments without properly exploring what that particular woman will need.
Mm.
Even in this part of, I mean, NHS is amazing, wonderful work. They're overwhelmed, and then women having to wait years for treatment, and their symptoms are getting worse. I mean, in my case, I had all kind of combination of medication that even created worse things, and I'm like, okay, I'm not having this anymore. So the numbers are really, really high, and we need to start to find ways of how women can get early intervention, and access to treatment early. So hence why we do what we're doing. So, but I don't know what's your experiences around. Did you ever feel like you were dismissed during your journey before you got to the treatment, at least that you had? Did you feel dismissed? Did you feel like you were being gaslighted? What was your experience?
Yes, of course. I wasn't aware of the concept of, advocating for yourself. And I took the consultant's word as, like
Gospel.
Yes, exactly. And I didn't quite understand the concept of this was kind of normal for Black women because I'd never heard of it. So how can it be normal when I've never come across, fibroids? So upon my research, that's where I kind of was able to learn more and be able to kind of ask questions around possible routes that they could take. So maybe I think in hindsight, they were a bit kind of concluding the hysterectomy, possibly. I'm grateful to them, and I'm not taking anything away from what they did. I'm
Absolutely.
very grateful. But I think I had to suggest them not trying to take them all out. So luckily I kind of done my research to be able to make that suggestion, because if they had tried to take them all out, maybe I would have bled too much and they would have had to do the hysterectomy. Because I had bled a lot with what they had.
Oh, wow.
Yeah, taken out. So
interesting. I got offered UFE, and was only at the very last after I'd been prepped and all of that, and then someone decided, no, you're not eligible for this because this and this, few of them in some places where it's not worth it. I'm like, really? After all of this, but honestly, I'm so like making sure that all of the options that a woman has is put before them, and then help guiding them, like we said earlier, to make the best decision for their own combination of whatever situation or what they're trying, the goal is, what they're trying to achieve. And this is really, really key. And if you've had any surgery and share one tip that helped you recover, put it in the chat and let us hear from you. Quickly, before I come back to you, Nina, I wanted to go to Dr. Omar. What advice can you give patients post-op regarding post-op healing, and how can they spot complication early? Because this is really key.
Yeah, it's very, very important to prepare themselves before surgery. I know they have a heavy bleeding, very heavy bleeding and pain, and the iron level and sorry, the hemoglobin is, if it is optimized, then the woman, even if you do the myomectomy, they are not need for blood transfusion. If they have optimized hemoglobin and iron level in the body. And also weight is very, very important, because what make it difficult, the weight of the women is how much they're overweight, how much the difficulty in performing the surgery. And that will impact on the recovery also, especially after the surgery. The mobility is very, very important. Good diet, healthy diet, and start doing movement and exercise, mild exercise as much as possible, and eating good food and also be positive, because sometimes every person go through the surgery have some psychological, like depression, why I should go through this, why I should have this, what is going to happen. So be positive, and also discuss it with the family, and if there's any family member can protect you and can support you during surgery and after surgery is very important. As I said, mobility and exercise is very important. And if there is any sign of infection, quickly highlight it, because there is a risk of infection. And also if you're fainting, if you're feeling very weak, highlight it, just in case after a few days you feel that you are weak and your hemoglobin or your iron level is coming down. You can always come back to the hospital to be checked. Don't just sit around, and because all these things is enhance the recovery. And be positive before the surgery. Understand very well what you're going to do, what you're going through is very, very important. If you don't understand what you're going through, even the incision, even if the type of the surgery, what you're going through, you may not have all the information. You may have information, but you're not able to read it properly and absorb it properly. Ask the question before the surgery. And then after the surgery, make sure that it's been explained to you very well. What happened, why it has happened, what is the reason for this and that. And then when you know everything, and we should be also transparent with the patient what we did. And then that recovery will be much better. That recovery which we must, I give you more hope that you know that things go on and you go forward. And from now, you have to look after yourself and hopefully everything will be in the right direction.
Oh, amazing. Thank you. Thank you so much. Okay, so we're going to carry on with more questions for you, Dr. Umar.
Yeah.
So
Mhm.
explain to us,
Mhm.
how does fibroid affect fertility and pregnancy outcomes? Which ones? How does, I mean, Nina earlier on mentioned how she's had multiple miscarriages. I've had
Mm.
multiple of those of miscarriages as well. So
Yeah.
explain to us how fibroids
The
can
reason
affect
miscarriages can
pregnancy
happen,
outcomes.
yeah, because of the fibroid, it's changed the shape of the womb and shape of the cavity. If the room is not in the right direction, it's not like 4x6 or 4x4. It's all corners and things. The fertility, the implantation of the embryo will be in the wrong side. Either infertility will be happen or can be implanted, but can cause miscarriage because it's not growing in the right direction. And
Mhm.
also the placenta is not going to be in the right direction. So if the fibroid in the wall of the womb bulge into the inside the wall, inside the cavity of the womb, or there is many which change in the shape, that
Mhm.
affect the fertility. And sometimes they are growing just under the tube. Is changing the direction of the tube to right or left or wrong direction. So even if the egg go through or the sperm go through, they don't meet each other. Or
Right.
the fibroid is pushing the ovary into a wrong direction because they are so big and completely blocking the passage. That will affect the fertility. And most of the time, the fibroid which is sitting inside the womb, as they are big, it may like a foreign body. It's like you have a contraception inside the uterus. So the fertility. These are the fibroid which causing the problem as a fertility. And the treatment, as we discussed, the uterine artery embolization have a risk of 5% chance of affecting the ovary. When
Right.
affecting the ovary, it's when you are menopausal. So the only option next will be a egg donor. So that is affecting the fertility. And if the woman have a religious reason not to have egg donor or doesn't want to have for social reason, doesn't want egg donor because egg donor also is not easy thing because after age of 18, they should know the biological mother.
Mm.
So, and then they end up with infertility. Myomectomy by itself sometimes can cause infertility. Why? Because it causes
Wow.
scarring. When it
Mhm.
causes scarring, it causes blockage of the tube. When it's
Right.
blockage of the tube, then affect fertility. But IVF still it is possible to be done. So these are, and if you end up with hysterectomy, it means that's end. There is nothing else you can do unless if there is one case of uterine transplant happen in UK and the first birth is happened 32 weeks of pregnancy with a woman, but that's how that happened. Why? The chance of that is very, very low to every woman if they, unfortunately, before they having children and end up with hysterectomy to go through that. So it is,
Mhm.
these are the problem. But the surgeon, after doing the surgery, can explain that
Mm.
that woman can go through hopefully fertility, not infertility. They can be pregnant and having a baby.
Mhm.
And sometimes, if you take in the fibroid from the inside the room of the womb, you have to advise the women when they become pregnant, they have to have cesarean section, not or
Oh,
vaginal delivery.
yeah.
So
Yeah.
these are the things should be documented all the time. But if you take all the fibroid away, the wombs will be fine. And then even if there is a problem with the scarring and
Mhm.
a natural pregnancy, there is a IVF pregnancy can be successful.
Okay. All right. Thank you for that. That leads me to the next question that someone sent in. Um,
Mhm.
how they're saying, how do fibers, no, how can I reduce risk of fibers coming back after surgery?
That's true. If your fibroid is all been taken away, because unfortunately some fibroid not been taken away. If your fibroid has been taken away, and also that, as I said, if you are overweight or style of life is not a stressful job and these things, and
Yeah.
don't take any supplement from Holland and Barrett and over the internet, which most of them they have a hormone you don't know. Good activity, Then the
You must say,
fibroid.
don't take supplements from Holland and Barrett.
Yeah, there is something in Holland and Barrett and over the internet. I have found out now. I read every single bottle the women bring in. Sometimes they can have a hormone, so read through everything which is content of.
Yes, it's
Because
important to always read.
yeah,
Yeah.
yeah, because it stimulate, and also yam and soya milk and soya yogurt, don't take them because it has estrogen effect, and plant which has estrogen effect. So it's much better to avoid those things. Style of life, exercise, a good diet, this and because overweight, unfortunately, in the fat tissue there is a lot of estrogen, and that will help out again to have a fibroid to be developed again. It does take a long time, but it will come back again. And if you have a myomectomy in early age, there is a possibility some fibroid grow in a different place of the uterus by itself again.
Right. Okay. So, I
Yeah.
mean, it can just be new growth, in
Mhm.
different areas.
But
Interesting.
unfortunately, I've seen the girls which they have a surgery abroad. For
Mhm.
example, when they are from Nigeria or Jamaica or Ghana, have their fibroids, some of them removed and some of them left out, and they become bigger later on. That's the sad story, because it's the most difficult operation for me, which my hand on my heart, when I go back to open a woman having a myomectomy before, because it is very sticky, very scary, and very difficult
Mhm.
to remove the rest, unless if I am very lucky.
Mm. Oh, wow. Oh,
Mhm.
wow. Okay. So,
Yeah.
um, what's your advice on managing heavy bleeding day to day
Mm.
while waiting for treatment? Because we all know how
Yeah.
the backlog is with NHS.
Yeah.
What's your advice on
I think
managing
I
heavy
think
bleeding?
the taking the tablet, which is now recommended and GP can prescribe, although they always initiate, they want initiation by the consultant from the NHS.
Mm-hmm.
You can insist. You can insist to Marina coil now can be inserted by the GP surgery and family planning. They can have that. Make sure that your iron level is good, because the iron, if it is low, it causes um, friability of the vessels, and that will cause more bleeding.
Any tablet in particular or
Tranexamic acid sometimes can help. That is just
okay.
to avoid too much, not to clot the vessel. But Ryco should be initiated until you are seen in the hospital. Or there is Yazelta, also is a tablet which is also used. But unfortunately, some GPs, they don't initiate it unless if the consultant. They can do consultant connect, to be honest, which is they can take advice. You can
Mhm.
insist to the GP, say, I can't wait till next year, because some women have appointment next year. I see patient, the reason why they come to private, because they have next year appointment.
Appointment. I hear you. I hear you.
Yeah, so you have to tell them, to tell the GP, can they consult over the phone the doctors and can send all the information, then they can make a decision and make initiation of the treatment, which is Ryco, Exalta is available, tranexamic acid, marina coil, and then when you have the consultation, you already have your part of the treatment is done. Then they can decide what is next to be done.
Okay.
Yeah.
Amazing. Thank you for raising that. So one route to have a
Mm.
quick
Yeah.
um to go through that quickly is to request for telephone
Mm.
consultation so that you can
Yeah, there is a
yeah,
telephone consultation. They
instead
call
of
it
waiting for
consultant
so
connect.
long, I'm bleeding out. Yeah.
Mm. Yeah. Say I am losing my body blood every day, so that's not fair.
Mm. Oh wow. Oh wow. Thank you. Thank you. Amazing, amazing stuff. Also, from your perspective as a clinician, uh,
Mhm.
how do you guide women to
Mhm.
advocate for themselves for timely care? I know that you've just mentioned that it's important to, if you're being pushed back, ask for telephone consultation. What other ways can women, advocate for themselves for timely care with the GP
They
especially?
have to be vocal. They have to be pushing. They have to contact the GP as much as they can. because sometimes every heavy bleeding, every problem is taken into account is the same. Not every heavy bleeding, because I have seen even young girls, they come in and they have this heavy bleeding, but they say, oh, I've been told it's okay, it's normal, is take a pill. They have to be insisting at least, if not diagnosed, can they have a ultrasound be booked? Because
Right.
the doctors, they do ultrasound booking. And more or less, to be honest, I have found out now, not less than 6 weeks, they can have the ultrasound, at least to have
6 weeks.
where is the fibroid, where it's coming from, and then they can have that. At least they are prepared, because that all delay. If you go to the hospital and you have no ultrasound, you have not done anything, then they start from there, which is too long. But if you have everything in your hand and you have everything has been done, and you just go there for the decision to what's next can be done for you, that is much easier.
Quicker way to get answers and to get help.
Yeah, and
Amazing.
then you get answers and read about it.
Oh yeah,
A lot of information now
very
on the internet.
important.
In our Instagram, there is a lot. So
Yeah,
the
there
women
is.
should read them, should listen to us also.
Do
And
it,
then
doing
they
their
have
own due
information.
diligence.
Yeah,
Yeah.
yeah. Be your doctor. Be
Yep.
yourself's doctor.
Yeah, your
Because
spokesperson absolutely is important. Is important because if you don't speak up for yourself, you know, sometimes no one's going to. Yeah.
Yeah.
Thank
Don't
you.
go to the doctor as if you know nothing. That is a wrong thing.
Yeah. Yeah.
Don't ask you. I'm not saying go there and make yourself as
A
you
nuisance, yes, but be informed, educated, very
yeah,
important.
yeah,
Yes.
yeah.
Yes.
When sometime when I am tired or not thinking that much
Yeah.
properly, and the patient saying, "What about that
This.
one?"
Mm-hmm.
I'm
They prompt
really
you.
like waking up. I'm really waking up and say, "Oh yeah, that's
Oh
right.
yeah, that's another way.
Sorry, I
Absolutely.
forgot. Sorry, I forgot to mention that."
Yeah.
So know things. This is the time is gone. You don't know anything, and the doctor is God and have to tell you what to do. Is you
Not
respectful?
anymore. Not
Yeah,
anymore. Yeah.
you are very respectful. Be respectful, but go there with the knowledge.
Okay.
Don't make a decision 6 months after you've been seen. Make a
Absolutely.
decision where you are there. And
That's
if
right.
you are in the hand of a very junior doctor, doesn't know, say, can you ask your senior? Can I see your senior?
Can it,
It's not
yeah,
a problem.
you request, yes, you
Yeah, you
yes,
want
you
to
can
say you
request
need
to
to
see
be
someone
seen.
else.
Yeah,
That's
you want
right.
to be seen. You have right to say, can I have your senior to talk to? Is that okay? I don't think anyone can that time be resisting you unless if the senior in a holiday. But you say, okay, fine. Can I have the telephone conversation with your senior? This
Yeah.
thing is very important.
It is
And go
indeed.
with the
It is.
knowledge.
Yeah. Be informed, be
Yeah.
educated, and advocate for yourself. And you know, if you're being pushed back,
Yeah.
always speak up and find ways to get the help that you need. Also,
Yeah.
quickly,
Yeah, don't be
if
frightened.
anyone,
It's not a problem, to be honest. As far as you are, sorry.
you're going in and out. Okay, I was just going to say, if you've got any questions for Dr. Omar, please put in the chat. Another question that was sent in, Dr. Omar, is: are there genetic factors or family history linked to fibroids? Did you hear the question?
Yeah. And and carb, to be honest, family factors is very important. If your mother have it, there is a possibility. If your sister have it, there is a possibility you may have it. Even if you are not black or genetically not related, because I have seen it quite a lot in other nations recently, and because they have, their sister have it, their mother have it. Yeah. If any family member have it and you have a heavy bleeding or pain period, it's better you be diagnosed.
So early diagnosis is really important, especially if you've got family history, if you know someone in family who's had it. Thank you.
Because the problem sometimes they don't know. Oh, my mom had a hysterectomy, but I don't know why.
Right.
It's better to ask, see why. Yeah.
And also the parents, we need to
because
be
hysterectomy.
And parents, we need to be telling our daughters, we need to be telling,
Yeah.
speaking to them, especially if we've had these things, we need to help them understand and also be able to have early diagnosis as well. Yes.
That as early as possible, and they deal with it as early as possible.
Thank you. Thank you so much. We've really covered so much tonight, from symptoms to recovery and a bit of advocacy. But one myth about fibroid that you would like to bust, Dr. Omar, one thing that one myth about fibroids that you would like to bust, share with us.
Oh, fibroid.
You're upside down, Dr. Omar.
With the fibroid.
You're sideways.
Oh, really?
Yes, now you're fine.
Yeah. Okay. Yeah. What was the question? Sorry.
One myth about fibroids that you would like to bust. Something people believe about fibroids. Yeah.
What to believe?
One thing that people believe about fibroids that you would like to bust. Personally,
sorry.
I said one myth about fibroids that you like to bust. One thing that I'll go first if you want. When people think fibroids only happen to older women, it's not true. Young people, yes, young people can get fibroids, even teens.
No. Because they get diagnosed late. That is why they think it is only an old woman's problem. No, the fibroid can be happening even in 17-year-old if they have a growing, because some people, unfortunately, they have a growth of fibroid very quickly, and someone else may have a fibroid for years, and even they didn't know until they have some scan in their late 60s, 50s, they have 2-centimeter fibroid. Some people's fibroids grow very quickly and can be in any age. It can be in any age. So any symptom which is not usual is not what you think, has to be investigated. And the scan is the easiest one can be. And if you have a scan and say multiple uterine fibroid, insist on MRI scan, which is the consultant, then NHS should do MRI scan. The GPs are not allowed to do it, because then the MRI scan can tell you the numbers. Although, even that, when I do a myomectomy, I can find out fibroid behind fibroid can be hidden.
Wow.
Even MRI is very difficult to do. I mean, I had one of my patients on Monday. It was said multiple fibroid, but most probably 5, and it was 21.
Oh no!
Yes, yeah, it was 21.
Wow. Oh wow!
So I'm always prepared for the higher number than lower number.
Yeah. Awesome. Thank you for sharing that. I'm going to read some of the questions in the chat as well, so people opportunity to get the questions answered. So someone says, what should we look out for in the supplements? What hormones should we look out for in the supplements?
Any hormone like estrogen, progesterone, testosterone, be careful.
So when you say be careful, you don't want extra.
You don't want to take those because you don't know, because you are supplementing yourself without knowing what is it.
True, because you haven't got tested and you don't know, even especially if you have an imbalance and you don't know what you're short of, what you have. Yeah. So taking, I hear you. So except you know what is your imbalance looks like, hormonal imbalance looks like, you should have take. So I get that. Thank you for answering that. Did you say we should avoid yams? Somebody was asking.
Yam, soya milk and soya yogurt. Yeah.
Yam, milk, and soy yogurt. So
for Black people should avoid it, although you have quite a lot of yam. Food.
Yeah,
and
we eat a lot of yam.
Carb as a whole, carb, especially rice. Yeah.
So avoid or reduce?
You can't avoid it.
That's a reality. My question. So avoid or reduce?
That's a reality. You can't avoid it, but reduce as much as you can.
As much as possible. Absolutely. Thank you for that. Someone's asking, can I do a myomectomy surgery when I'm underweight?
when she's underweight,
Yeah.
yeah, that will be a best candidate for it, because underweight is not a problem for myomectomy. Why not?
Okay. All right.
Mm.
Thank you for that. Someone also said, does endometriosis lead to chronic weight loss or being underweight?
Endometriosis is a more or less disease of the slimmer people than a higher weight people, although the estrogen also is a predisposing factor for growing of the endometriosis. But
Mm-hmm.
it's not a cause for the losing weight. No, there should be another reason for losing weight, unless if you are on a diet or exercising too much. But endometriosis by itself doesn't cause losing weight.
Right.
Mm.
Okay. Thank you for answering that. Okay. And there's another question. How do fibroids affect you when you're not on your period? So, like, what symptoms? What are the symptoms? What other
Pressure.
fibroid symptoms are there when it's not?
Pressure symptom, and you feel in lumps, especially when you wake up in the morning and your blood is full. You push
Mhm.
the uterus up, check your tummy, and sometimes the women come and they find out just a lump in the tummy, and they found out. I had a lady, I did a hysterectomy for her on Tuesday. She found she was losing weight, but she couldn't lose weight properly on her tummy, and when her trainer touched her tummy, said, "Oh, there is a lump there." But she
Mm.
never knew that she had a fibroid, multiple uterine fibroid.
I know, right? It used to feel like balls. I remember
Yeah.
you can literally feel them. I'm like, what on earth are those?
Oh,
Yeah, I hear you.
oh. Or going to the toilet very frequently, or going sometime affecting the nerve and stimulation of the nerve and constipation, and
Mm,
feeling full very quickly.
yeah, yeah.
Mm.
Thank you. Thank you. So yeah, thank you for answering that question. Um, this one says, what's your thought on hysteroscopy and can acupuncture help fibroids?
Acupuncture, I don't think acupuncture doing anything apart from pain. Sometime when you have acupuncture, may reduce the pain. But I don't think fibroid. But there is a radio frequency which is used in America. It's not a practice in England and any other European country. They
Okay.
say they're reducing the size of the fibroid, but I have no experience. But I don't know how much reduce the size of the fibroid, because radio frequency may affect the blood supply to the fibroid, but don't forget radio frequency also. The fibroid is inside your tummy, may affect also the function of the bowel and blood.
Oh wow.
Mhm.
So it's about just weighing out the pros and cons and what
Yeah,
your
yeah,
goal is ultimately.
yeah.
Let that decide how you go with your treatment.
Mhm,
All right.
mhm.
Thank you for that. Also, someone's asking, can degenerative fibro be seen on an MRI?
Yes, yeah, yeah. Can
Mm.
be seen in the MRI. There are many type of degeneration. It may become cystic, may become hyaline, which is full of the fluid, and maybe red degeneration when the blood supply to the fibroid become less. They call
Mm.
it red degeneration. But there is unfortunately one condition which is very, very rare. So don't nobody to be afraid of, is 1 in 1,000,000, to be honest, is sarcomatous change. This is also
Mm.
degeneration. Yeah, that's a change of the fibroid.
Wow. Okay, let's see what about time. Oh God, our time is fast spent. I'll take one more question and then we try and
Okay.
round this up. Someone says, if one has a 1 centimeter fibroid, what should they be advocating for?
Oh, don't worry about it. In a 2-3 years time, just have another scan to see if there's increasing.
Yeah, but Dr. Ma, I don't like that word, don't worry about it, because when you say to someone, don't worry about it, so I understand don't worry about it, but they need to be aware and
Yeah,
living lifestyle
yeah.
changes,
But where it
making
is,
sure that, mhm.
where it is, 1 centimeter fibroid inside the cavity of the uterus is more important than the 1 centimeter fibroid sitting on the top of the womb. So
Mm,
it is very different. But what age also find out they have 1 centimeter fibroid.
age. Mm,
Mm, mm.
okay. That's interesting.
Position is important. Age and position is important. And how it is found is incidental finding, or it is found because of the
Because the
problem.
symptoms, yes, yes, absolutely. That's really key. You know, how was that found? Was it incidental, or was it because you were having symptoms? And it's really important to guide women, you know, around being aware and watching out your lifestyle, understanding what kind of food will make them go bigger and trigger stuff, and just, you know, being on if you like, straight and narrow, ensuring that they don't get bigger as much as possible, you know. Just keeping tab and keeping track and making sure that you're watching them. So amazing. Thank you so much, Dr. Umar.
Thank you.
You know, thank you for this evening. We covered a lot, you know, and to every woman listening, your pain is real, your voice matters, and together we keep pushing until fibers and women's health get the care that they deserve. So follow us on our Instagram pages, on our YouTube, comment on our videos, support us, share this life with another woman who you think needs to hear it. And if you have questions, you can still send in your questions. We can help answer. We send them to Dr. Umar to help answer. The Feminine Health and Fiber Network, we believe that no woman should have to wait long time for care. And so we advocate for early care and early care plan. And that's why we're advocating early intervention for women, faster diagnosis, you know. So no matter where you are, we want to be able to ensure that women are being seen, are being heard, and are being helped. Thank you, Dr. Kaza. Thank you, everyone. Thank you, everyone who's joined tonight. Thank you, everyone who's joined the conversation tonight. Thank you for your questions. Your voices are part of the bigger movement for women's health. Thank you. Let's keep speaking up. Let's keep creating awareness, early intervention, and equal access. But before we close, I wanted to share something quickly before everyone leaves. Honestly, something close to my heart. Next week, from the 21st and 23rd of August, believers all across the nation will be gathering. We're doing a conference called Battle for Britain Prayer Conference. It is going to be in Manchester. So this is a call to unite in prayer for revival, healing, and restoration for our land, Britain. So whether you can join in person or online, your prayers, your presence matter. Let's stand together. And also for women's health, for our communities, and for our nation. Let us join the movement. Let's believe for change. So come join us and let us pray for Britain. Thank you, everyone. I hope this has been helpful. I hope you got something today. And if there's any burning question that you might still have, please send them in, DM us. We will do our best to get them answered for you. And if you need support, if you know anyone who's going through, we should not be quiet, not be silent. Reach out. We are happy to help and to support you on your journey. We want to bring hope to women. So thank you, everyone. Thank you, everyone who's joined today. God bless you and have a lovely, lovely evening.